In this video by deckplate we will understand how the VA rates gastroesophageal reflux disease, new changes to GERD rating, May 2024. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. If you are a veteran suffering from gastroesophageal reflux disease, understanding how the VA rates your condition is crucial for receiving the appropriate benefits and compensation. The VA has recently updated its rating criteria for GERD as of May 2024, and it's essential to be aware of these changes to ensure you receive the benefits you deserve. The VA uses diagnostic code 7206 to rate GERD, and the new criteria focus on the severity and recurrence of esophageal strictures, narrowing of the esophagus, and the associated symptoms and treatments. Here's a detailed breakdown of the new rating criteria. 80% rating. Documented history of recurrent or refractory esophageal strictures causing dysphagia with at least one of the symptoms present. 1. Aspiration, inhalation of food or liquid into the lungs. 2. Undernutrition. 3. Substantial weight loss as defined by Section 4.112a. Treatment involving either surgical correction of esophageal strictures or percutaneous esophagogastrointestinal tube. 50% rating. Documented history of recurrent or refractory esophageal strictures causing dysphagia which requires at least one of the following. 1. Dilatation, stretching of the esophagus, 3 or more times per year. 2. Dilatation using steroids at least once per year. 3. Esophageal stent placement. 30% rating. Documented history of recurrent esophageal strictures causing dysphagia requires dilatation no more than 2 times per year is rated 30%. 10% rating. Documented history of esophageal strictures that requires daily medications to control dysphagia but is otherwise asymptomatic is rated as 10%. 0% rating. Documented history of esophageal strictures without daily symptoms where the requirement for daily medications is assigned with 0% rating. Important notes on GERD rating. Findings must be documented by barium swallow, computerized tomography, or esophagogastroduodenoscopy. Non-gastrointestinal complications of procedures should be rated under the appropriate system. This diagnostic code applies, but is not limited to, esophagitis, mechanical or chemical, Mallory-Weiss syndrome, bleeding adjunction of esophagus and stomach due to tears, due to caustic ingestion of alkali or acid, drug-induced or infectious esophagitis due to candida, virus, or other organism, idiopathic eosinophilic, or lymphocytic esophagitis, esophagitis due to radiation therapy, esophagitis due to peptic stricture, and any esophageal condition that requires treatment with sclerotherapy. Recurrent esophageal stricture is defined as the inability to maintain target esophageal diameter beyond 4 weeks after the target diameter has been achieved. Refractory esophageal stricture is defined as the inability to achieve target esophageal diameter despite receiving no fewer than 5 dilatation sessions performed at 2-week intervals. The new changes effective in May 2024 highlight the importance of detailed medical records and proper diagnosis. If you have GERD and are experiencing severe symptoms or undergoing frequent treatments, review these new criteria carefully and consult with your healthcare provider to ensure all necessary documentation is in place for your VA claim. Thank you for watching this video. Please don't forget to subscribe and like our videos.